Good morning, everyone. So welcome to the education training. Thank you for writing your names, and I can see names on the table. So this is Ms. Betty, Mr. Jasmine, Sarah, and Cecilia. So thank you for registering for the education training, and I am your trainer today. Today's topic will be ostomy care training and ostomy care education training. But before we start off with that, let's have more social interaction first. So we start off with the icebreaker session. Icebreaker session is meant to make you know each other better. Okay? So, the icebreaker activity that I would like you to take part is 2 truths and 1 lie. So you're going to prepare 3 information about yourself. 2 true information and 1 information that is untrue. Okay? Later on, you come up in front and appoint one of your friends here, one of the participants here. Okay, because the names are written, so you can call Sarah or Miss Sarah. Appoint Miss Sarah to answer to you. Then you ask following this. So you can say, "Hi Sarah, I am," then your name. So for example, maybe I make the first noun first. Okay. Hi Alice. Say yeah, Alice is here. I am Tia. Nice to meet you. I am a nurse student from the Adventist College of Nursing and Health Sciences. I would like you to know me more. Could you please guess which of the following is true and which of the following is untrue about me? Okay, so I dislike durian, and my birthplace is in Ipoh, Perak, and I am a mother of 2. Then Alice will respond. Okay, then after that I will feedback. Okay, whether it's true or untrue. And after that, the person who answers, that means Miss Sarah, will then become the person who appoint the next one to go with the activity with her. Understand? Okay? Right. So in this case, you get to know 3 information about each of the participants. Alright? Shall we start? Okay. So you can use this as a template now to guide you in talking, and basically it is read the person, after that which person, introduce yourself and say about 3 information. Would you like some time to prepare the information for yourself? Okay, 1 minute. Right, 2 true information, 1 false information about yourself. So you are going to say it out later on. Twenty seconds more. Okay, are you ready? Anyone ready? Who wants to be the number 1 to come up here? Miss Priscilla? You ready? Okay, thank you. Okay. Welcome, Miss Priscilla. Yes. So you choose 1 person. Yeah, you appoint 1 person. Miss Betty. Yes. True. Second is I dislike watermelon. True. Like watermelon. Correct. And the third one is I can ride motorcycle. Ah! Is it true or true or untrue? Untrue. True. Correct. So she has answered everything correctly. How about you? Okay. Thank you. So this participant can come up here and appoint another participant to join you. Hi, Jasmine. I am Betty. Nice to meet you. I am a scrub nurse from the Adventist Hospital. I would like to know, I'd like you to know me better more. Could you please guess which of the following are true and which is actual about me? And I am married.
Yes, true.
I'm from Sarawak.
False, lies.
I can cycle motorcycle or drive motorcycle. Spending and take a motorcycle.
Lie.
You mean untrue?
Untrue.
Is that the correct answer? False. False. So now you get to know Miss Patty more. So Miss Patty is not from Sarawak. Miss Patty can ride a motorcycle. And number one is what Miss Patty can. Miss Patty has married. Yes. Good information about you. Thank you for sharing. Now it's your turn.
You say that?
Yeah.
My name is Jasmine. Nice to meet you. I am a staff nurse from Clinic Adventist Hospital. I would like you to know me more. Would you please guess which of the following are true and which is untrue about me? I like to play badminton. Is it true or lies?
True.
Okay, correct. Then I like to watch movie. Is it true or lies?
Right.
Actually, it's true. Okay, the last one. I didn't like it miso.
Right.
Yes.
Okay. So thank you, Mr. Jasmine. Sarah. So Sarah will appoint Priscilla. Hi, Priscilla. I am Sarah. Nice to meet you. I am a nurse from the Adventist Hospital. I would like you to know me more. Could you please guess which of the following are true and which is untrue about me? I like to eat patay. Untrue. Right. I was born at Hospital Syrian Sarawak. True. Both of you from same hospital. Both in the same hospital. Oh. I like blue color. So, yeah. Okay, thank you. And thank you everyone for your participation. Okay, so I hope from the session just now, you all know each other's name and you know at least 3 information about each other. Okay, I get a conclusion that Miss Sarah and Miss Priscilla born in the same hospital. Alright, good. Okay. So we come back to, let us start with today's education training. So the title of the training is Ostomy Care Education Training. Okay, so ostomy care is what we're going to learn today. And the main objective of this is to provide you a better knowledge. And then it consists of 3 modules altogether. The first module is to provide you a better knowledge about ostomy care, about what is ostomy, right? And then after that, it will be moving to module 2. So module 2 is more on activity. So I will show video, I will do demonstration, and we will do written demonstration and other activity as well, right? So this is a hands-on skill. So you gain knowledge, you gain skill. The third module is about teaching how the patient, give teaching and also guidance to the patient so that they can live a better, meaningful, and also more productive life. Okay, patient with ostomy, right? So, okay. Okay, so before we start off, I would like to introduce about myself more. So my name is Jia Su Yan, and my current position is nurse tutor. Okay, working in this college, Adventist College of Nursing and Health Sciences. I graduated in 1995, long time ago. You haven't born yet. Right, so then I get my diploma in nursing from Penang College of Nursing. So Penang College of Nursing is a government institution, right? So I was sent by a private institution, I mean sponsored by this private institution, to go to the government institution for training. And after that, I come back after my graduation, so I go back to the hospital and serve the hospital. Okay. Then continue with that in 2001, I pursue further study to get post-basic pediatric course. So I go back to my same college again, Penang College of Nursing, and then all this while I have been working in the pediatric ward. I've been working for a good 16 years in pediatric ward, right? Then in 2011, I got my Bachelor of Science in Clinical Nursing, and this is from my University of Hertfordshire, KU affiliated with this university. So I got my study there in 2012. In end of 2011, I started to join this institution, Adventist College of Nursing. Then in 2012, I further study to get the teaching and learning course. And these are getting in IMU and until now, right? So at the moment, I am still in progress of taking my master. Okay, so this is about me. So let's go back, okay, to the main topics of today. So as I said just now, we have 3 modules. So module 1 is facts about ostomy and ostomy care. Right? So the learning objective for this module 1 is, at the end of the session, participants will be able to recall the normal anatomy and physiology of digestive system. Because when I talk about ostomy, right, I put my emphasis on the digestive system. Right? And define the terminology introduced, explain the indication and types of ostomy, relate the different types of ostomy appliances, and the correct way of storage. So with this, relate the different types of ostomy appliances. I have also a few samples here. So later, these will serve as an exhibition book. And then you can visit this table later on. And then next is name the resources of ostomy appliances. So you need to know where can you buy the ostomy appliances. Then only you can introduce it to your client, okay, or to your patients, where to get the appliances, right, or the supply, okay, the supply, and discuss the complications and care for the common peristoma skin problems, okay, because peristoma skin problem is the most important thing and also the most common problem that the patient faces. So let's start off with the first topic, so normal digestive system. So normal digestive system is start from where and end where. So start from the mouth and end from the anus. Yes. So the upper part of the digestive system, you have the oral cavity here, and then you have then comes to the esophagus, bring the food down, and then to the stomach, and after that, from stomach onwards, it do the main job of digestion. Okay, they can speak. Juice will do the work of digestion, and then carry on, bring down the gastric content down to the small intestine. And the small intestine and big intestine is the main focus of what I'm going to talk about in this training. Yeah. So the small intestine is divided into three parts. So duodenum, jejunum, and ileum. Okay, so the terminal ileum is very close to the big intestine. Right? So the big intestine starts from here. So you have the big head here called cecum, and after that here ascending colon, transverse colon, and then descending colon, sigmoid colon, the curved part. Then it comes to the rectum to store the undigestible material that is feces, and then after that will excrete out from the body. So beside the main digestive tract, you also have accessory organs. For example, the liver, right, the gallbladder, and the pancreas. But this I will not include in the teaching today. Okay. So the main point of focus for you to recall the digestive system is food nutrients are digested and absorbed in the small intestine. So remember the four major functions of the digestive system. Number one, ingestion. So you take in food, right? Then after that, the food travel down, and number two, digestion. So stomach and part of the small intestine play an important part in digestion because it contains enzyme. Then after that, a major part of the small intestine also will take care of the absorption. So nutrients, all nutrients, okay, when it moves down by peristalsis, it will be absorbed in the small intestine. Right? Then after that, following that, after absorption, then the food content continue to flow down by peristalsis, and it will go down to the large intestine. So the major work of large intestine is to absorb water. And so now the content, the material, okay, the intestinal material has become more and more solid. Okay, as it goes from one part to another. Right? And eventually this content is getting drier and drier, and then it will store in the rectum until you have the sensation, the feelings of wanted to pass motion, and then you will evacuate it out. So cecum is the first part of the large intestine. Okay, cecum contains the contents are highly acidic liquid. Okay, so beside the undigestible material, it contains highly acidic liquid. Because it comes from the small intestine, the immediate part after the small intestine. Then it goes up. So this is ascending colon, the contents are also acidic. Transverse colon, then the content will be less acidic. This the intestinal juices is getting less. And descending colon is here, sigmoid colon is here. The content will become more formed, and there will be no digestive juice here. Okay, and in the rectum, content will be soft forms too. So talking about today's topic, the main things is about ostomy care. So first of all, we need to know what is stoma. So the picture shows you clearly this is stoma, right? But then how? Okay, so how to elaborate about it? Stoma is a Greek word. Okay, it means mouth. Mouth, so it is an opening and it means mouth. So stoma, mouth. The opening of the ostomy on the skin is called stoma. Right? Opening. So the structure of it is same like the inner lining of the intestine. It is reddish in color, so you can see clearly here. Very nice stoma, right? Reddish color, and it should be warm and moist, and it secretes a small amount of mucus. This is its normal function. And remember, stoma, okay, there is no nerve ending. So the patient has no feeling of pain when you touch on it here, right? So this is an important point to take note. And also another important point is in the stoma there is no sphincter, there is no valve, right? So there will be no voluntary control of bowel movement. Anytime the stools come out from here, right, the patient will not feel the sensation of when it's going to come out. It just comes out, okay, involuntarily and not able to control. And the size of the stoma and the shape of the stoma may appear larger, okay, at the beginning of the surgery. So in the first few weeks of the surgery, the size will be bigger. Then eventually it will gradually shrink down and attains its final size in about 6 to 8 weeks. When we talk about 8 weeks, 6 to 8 weeks, so it's about 1.5 to 2 months. Right? 1.5 to 2 months. Okay. So stoma is an opening. Stoma, the Greek word is mouth. Then what is ostomy? Now some people used to say, okay, stoma care. And now the word has changed to become ostomy care. And so sometimes this stoma and ostomy is used, the word is used interchangeably. But to make it clear now, okay, what is more specific? Okay, ostomy means surgical creation of an abdominal opening that enable a connection from an internal organ to the skin surface to allow passage of feces and urine. So meaning ostomy is the surgery. Stoma is the opening. Okay, clear about the difference? So ostomy surgery usually is a life-saving surgery. And in these pictures here, alright, it says it's a surgical creation that brings up the internal organ to the surface of the abdomen, okay, to provide evacuation of either feces or urine. So what internal organ? As you can see from the pictures here, colostomy, one type of ostomy, okay, one type of the ostomy surgery. So it brings up the colon. Like ileostomy, it brings up the ileum, the terminal part of the small intestine. Urostomy, it brings up the ileum as well. You can see that urine that formed from the kidneys drained down by the ureters, and the ureters is implanted into ileum. So actually what is brought up to the surface of the abdomen is the small intestine. So clear? Now it says internal organ, so it mainly means the the big intestine or the small intestine. Alright? Okay. So just now we learned about stoma, about ostomy. Now more to know about the terms. Two more terms that you need to remember. Okay, ostomy. So what is ostomy? Ostomy is a person, is an individual who has undergone an ostomy. So if I have a disease intestine, I go for the surgery and end up I will have a colostomy here. So I am ostomy. Okay, that means the client with the after undergoing ostomy surgery. Ostomy, right? Next is enterostoma therapy nurse, or you call ET nurse. So who is this person? This is a nurse that trained in a specialized area, okay, who had undergone the stoma care course. So this nurse has got a lot of knowledge because has gone through the training. So obtain a specific qualification in stoma care. Right. So here the nurse will help the patient, okay, to provide stoma care education. Okay, I mean provide stoma care education to the ostomates and provide emotional and counseling to the ostomates. Holistic care, emotional counseling and also physical care, management of the stoma, right? And the nurse visit the patient before surgery, okay, before and after surgery. All right. Any questions so far? The four terms. The next we go to indication of ostomy. Right. Indication of ostomy means who are the persons that need to undergo this surgery. So a person that who has diseases. So for example, what kind of diseases? Inflammatory bowel syndrome. Okay, so this may include diverticulitis, Crohn's disease, okay, right, and or blockage. Blockage either the small intestine or the big intestine. They come to the point that the doctor has to do a surgery. Okay, so maybe bowel obstruction or paralysis. Right? Malignancy. Okay, so very high incidence of malignancy, CA colon, okay, or colonic cancer. So when we talk about congenital, yeah, some baby born with a congenital defect. So the baby also has to undergo ostomy surgery. And the last one here is trauma. So trauma also means injury. So maybe severe injury to me, and then I obtain a very severe rupture, internal organ rupture involving my intestine. So finally, the doctor may need to do the surgery. Okay, so indication of ostomy, diseases, blockage, malignancy, congenital problem, or trauma. So talk about going for the surgery, indication. Then now we come to the types of ostomy. So in today's training, I'm going to focus on 3 types of ostomy. Okay, the 3 types of ostomy that just now you have seen in the previous slide. Right? One is colostomy, and then the major focus will be colostomy. Okay, so we introduce to you about ileostomy and also urostomy as well. Okay, so colostomy. Let's see colostomy. A colostomy is a surgically created opening in the colon. Comes from the word, breaks down the words. You can see colostomy. Colo means comes from it's an opening in the colon. So more precise now. Just now when you say ostomy, you say internal organ, right? So colostomy is a surgically created opening in the colon, brought through the abdominal wall to take on the role of waste elimination. Or we can say fecal diversion. because this patient is no longer can pass motion naturally like ordinary people. Okay, the feces will have to divert and then come out from the colostomy. The site of colostomy can be from here, ascending, can be from here, transverse, and then descending, and also sigmoid colostomy. It names according to its location. Right? And colostomy can be done for temporary measure or can be permanent. Okay. So what is temporary colostomy? Temporary from the word you know that sementara, right? So why is temporary colostomy made? So this is to give the disease portion of the intestine a rest. So maybe I have some inflammatory bowel syndrome, right? Bowel disease, inflammatory bowel disease. So certain part of my bowel has become very inflamed and not able to work well. So colostomy is created so that this part is healed, alright, and so that when it heals, then the colostomy will be closed down. So give a rest to the diseased portion of the intestine, prevents stool from reaching it, so they can allow healing to happen. So temporary colostomy. So if a doctor tell the patient, this is only temporary, later on you do not have this anymore, just bear with it temporary. So when you say temporary, it can be weeks, months, or even years. Right? And eventually, at last, because it's temporary, so eventually the colostomy will be reversed. Okay, so reverse or remove, and then normal bowel movement shall be then restored. Meaning close off the colostomy, and then the patient can pass motion in a natural way. So that is temporary colostomy. The permanent colostomy says the disease portion must be taken off totally. So then, or permanently bypassed. So meaning that there is no chance, okay, to close the colostomy and allow normal way of passing of bowel movement. Right? It can be in the cases like cancer. Okay, cancer that is situated or located very low at the lower part of the large intestine, right? And then eventually the doctor will have to excise a big part of the colon, then plus the rectum or plus the canal as well. Okay, so in this case, there is no way to reverse the colostomy. Right? So it serves to provide an exit for stool evacuation. Okay, so patient live with this permanent colostomy. So how many types of colostomy you have? The colostomy named according to its location. 4. So what is this? You can refer to your answer. Ascending colostomy. Okay. So follows its location. Then after that, transverse. Okay. Then coming down, descending colostomy. So descending colostomy, if it is specifically situated at the sigmoid colon, then you call it sigmoid colostomy. Okay, so that is types of colostomy. Now we see types of stoma. The stoma is the opening. Now in the opening, bring up the colon to the surface of the abdomen. So I'm going to introduce to you 2 types. One is named end stoma. So end stoma means, when you see the diagram here, right? So this part is disease. So the doctor will have to stop here, okay, excise here, and then bring the proximal part of the colon bring it up to the surface of the abdomen and create a stoma. So you call this end stoma. Okay? And with end stoma, this picture is showing you colostomy pouch is attached to the opening of the bowel. Okay? So this is end stoma. The part of the colon that brought up to the surface of the abdomen is folded back and then after that suture. Okay, suture on the skin. Exactly like what is shown in the picture here. Okay. Another type is loop stoma. Okay, so a loop stoma is one stoma with two different openings. So meaning, you see, you look at the diagram here, so there is continuation of the intestine. And here we refer to colons, right? So the doctor bring it up to the surface of abdomen, slit it, but don't totally excise, don't totally chop it off. So bring it up and then sew onto the abdomen, right? So there will become what you can see is two openings, right? So when there is a loop stoma, usually it is a temporary colostomy. Temporary, right? Okay. Then next thing that we need to remember, because there is two opening here, right? So you see, look at the pictures here. The doctor bring up the part of the colon. Then after that, sew it onto the surface of the abdomen, right? And in between, the doctor will put a rod to prevent it from going down. Okay, so the side of it, this is a real picture of a loop stoma. And this small little rod is placed underneath to prevent the stoma from become retracted, means going down. And it usually will be removed in 2 to 7 days. Okay? So when you have two openings like this, it is very important to identify which one is proximal and which one is distal. Okay? So if you have a colon, look at the colon, it runs from here, transverse, and then descending. So the first hole here that is close to your body, so you call it the proximal loop. So the proximal loop will be the functional loop. Feces come out from the proximal opening. Understand this? Yes, because the food content travel, and then come out from here. So feces come out from the proximal opening. The distal opening, because there is no connection to join down, so it will be just secreted mucus. Okay, mucus material. So the distal opening is non-functional opening. Okay. So the type of colostomy, just now you are able to let me know very well. Okay, so there are 4 types: ascending, transverse, descending, and sigmoid. So we come to see to one by one. When you see ascending colostomy, so the disease part cut off, taken away, then the opening will be on the right side of the abdomen. So this picture is showing ascending colostomy. And the discharge or the content, okay, the coming out from the stoma is watery to muddy feces. Still contain of a lot of water because only a short portion of colons remain. The subsequent one that is distal to it already removed. So the remaining one is just very short portion that comes connected from the small intestine. So it is still very there is still a very high volume of fluid inside. And so the stool becomes watery. Okay, watery to muddy pieces. Okay, so important point to take note, ascending colostomy, the discharge will be watery to muddy. Next is transverse colostomy. The transverse colostomy means the openings is at the transverse colon. So when it is at the transverse colon, the location automatically will be on the upper abdomen, either on the middle or slightly to the right side. Okay? And the discharge will be muddy to soft feces. Because it has a longer portion here that remains, and so water continue to absorb here. So when it comes in here to be discharged out, it is not so watery already, but still considered very soft, right? Very soft. So muddy to soft feces. And it contains some digestive enzymes. Travel from here until here, there are still some digestive enzymes. So stool will exit, okay, from the colon before it reaches the descending. The descending has already excised. Okay, the descending colon is the disease part. So it's been taken away. So make an opening here to allow feces to come up, and the feces is muddy to soft. Okay, and usually transverse colostomy is temporary. That means there is a chance to do what? To do what? There's a chance for what? If it is temporarily, you think the patient hear this happy or not? Temporarily, yes, because there is a chance to do joining back, yeah. So anastomosis back or closure of colostomy. Okay, so then we come to the left side of the abdomen. If the colostomy happen to be on the left side here, lower left side of the abdomen, so it belongs to descending or sigmoid colostomy. Okay, so descending colostomy here, sigmoid colostomy is further down. Okay, the parts distal to it is excised. So the discharge of the feces will be soft to form stool. Because feces comes from where? Comes from here, the small intestine, then it travel and get absorbed the water, get more and more absorbed in the colon, and when it comes out, when it reach here, okay, already in the soft and forms texture. And it does not contain ostomy enzyme content. Why are we worried about enzyme content in the output? Because if it is leaking, enzyme is meant to stay inside. If it is leaking through this hole and spill to the peristomach skin, then it can cause injury and pain. It can cause skin breakdown. Okay, so knowing the location of the colostomy, knowing the type of the output, then this help you to get a better knowledge. Okay, whether this patient is having a diarrhea or not. If it is ascending colostomy, oh, this type of stools is not diarrhea because the output from the ascending colostomy is definitely more liquid. Okay, more fluid. Alright. So descending colostomy or sigmoid colostomy, now it says that sometimes bowel opening or elimination can be regulated. Okay, so only a small portion that's taken out. For certain people who has a very regular bowel habit, it can be retrained. Okay, can be retrained so that the output will come out at a predictable time. And another thing is doing irrigation. Okay, so doing irrigation at the same time every day, so helps to tell your body, oh, at this time I need to discharge the waste. But nowadays there is seldom, okay, we seldom practice irrigation, right? So any question about colostomy? The location, the output. Okay. So the second type of ostomy, ileostomy. So break the words and you know that this is a surgical intervention and it is made, okay, in the ileum. So surgically created opening in the ileum, brought through the abdominal wall to collect the content of the small intestine to the small bowel when the colon and anal rectum are diseased. So from these pictures you can see now all this blur area is the part of the colon. So the colon that is already excised. So no more colon here. The pictures here shows the colon already excised, taken out, and the end part of the intestine, okay, has become the ileum. So ileum, and it is then now bring up to the surface of the abdomen and create a stoma on the abdomen. Yeah, for the management of the elimination. So location, lower right side of the abdomen, lower right side, ileum, okay, and the discharge will be liquid or pasty. Okay, so it lost a lot of water. Okay, the water that this patient take down, okay, it goes through the stomach, goes through the small intestine. So the major work in the small intestine is, okay, one part of it to do the digestion, then after that is absorption of nutrients. So water we need a lot. Before it gets absorbed by the colon, it already come out. So the output is very watery. Okay, so watery or tasty. And it is high in digestive enzyme. Yes, directly come from the small intestine. Okay, so if there is a spillage of the output and touching the patient's skin, so patient with ileostomy, it has more challenge, okay, to manage the stoma because you do not want the output to touch the peristomal skin at all, right? So the skill of cutting the holes, fixing the bag, right, is very important. Okay, this it is high in digestive enzyme. Okay, the last type of ostomy, urostomy. Urostomy is to bring out urine. Okay, so urostomy also called ileal conduit. Okay, so ileal conduit is created when the bladder is removed. So the major cases that contribute to this is CA bladder. So bladder has to be removed or bypassed, and a section of the small intestine diverts the urine from the ureters through the abdominal wall. So what is brought up to the surface of abdominal wall? It is not the bladder, it is not the ureter, but a part of the intestine. The ureter, okay, is implanted into this intestine, and after that, this small intestine is brought up to the surface of the abdomen and let it evacuate urine. So it flows freely and also not able to control. Okay. Location will be lower right side of the abdomen, and because it comes out, okay, from the intestine, so the content will contain urine and also some mucus. Right? That's about colostomy surgery. So after the operation, if the rectum is intact, Everything is still there. Patient may feel the urge or even have some discharge from the anal area. So meaning, even though I have a stoma outside here, but I still have the urge of wanted to pass motion. I may want to go to toilet and then sit down, and then there might be some mucus discharge coming up from bottom. Okay, so this is true. What the patient tells you is true. Okay, we call that phantom. Later on, we will come to this again. Right. It may continue to secrete mucus that can be harmlessly passed whenever the urge occurs. Okay, so if the patient tells you, I have the urge of passing motion from bottom, then you already know the anatomy very well. You know that the feces already divert and come out from the stomach. But you don't tell the patient, you say, no, there will be nothing come out from bottom. No. Okay? Right? So there will be still, secretion of some mucus from the anus. Right. So we have finished part of the one. Do you have any question to ask? Yes. Urostomy has got more than this type that I showed. Okay, so but what I focus on today's training is ileal conduit, which is also the most commonly cases that you can see. Right? And it usually happens to a patient with CA bladder. If the bladder is intact, there is a possibility of coming out from the bladder as well, by putting in a tube and things like that. Other surgical procedures. Alright, so if no questions, let's proceed to a quick review. And I want you to give me the answer true or false. So, large amount of water absorption happens in the small intestine. True or false? False. False. So large amount of water happens in the big intestine alone. Alright. Ostomies are people who have undergone ostomy surgery. True. Some babies born with birth defect and some may require ostomy surgery. True or false? True, because one of the indication is for the baby who has congenital defect or birth defect. Yeah, so it doesn't. It is not necessary to say that colostomy, ileostomy, all these ostomy surgeries is for adults only. Okay, for disease only, for diseases only. Right? Okay, the stoma is on the lower left side of the abdomen. You have to know right, left. Okay. The output is soft to form stool, easier to manage, and contains no digestive enzyme. Not so worried for that it can cause a skin breakdown. So, which of the following is correct? A or B? B. Yes. Thank you for the response. Okay, so descending. All right. So we can take 5 now, biological break. Okay. Before we move to the next subtopic, so that is ostomy appliances and ostomy care accessories. Okay. Everyone. So we continue with the next topic. So this is about ostomy appliances. So that means the equipment that we need to put on the stoma, right? And ostomy care accessories. So besides the equipment, the main equipment, so what are the other care accessories? Okay, and it's more for skincare. Okay, skincare on that area. Okay, so the type of colostomy bag. One, we have a one-piece pouching system. That means the ostomy bag, so this is the bag, and the base plate this one. Okay, so it comes and integrate become one appliance. Okay, so this is a one piece. You have one on your table as well. One piece disposable. Okay, And it can be described as drainable or non-drainable. So if you look at the pictures here, this is drainable, right? It is one piece. It's but drainable because there's an opening here, and you need to clip it so that it will drain, right? And this is non-drainable. So non-drainable, like this type also is non-drainable. So you use this. You also call this closed end colostomy bag. And another characteristic, it can be transparent or opaque. So transparent, it will be good that to be used initially after the surgery because you can see the stoma clearly, you can see the output clearly. After some time, then the patient will want to change to opaque. Okay, opaque this time. So that the feces will not be able to, will not be so obvious to be seen. Right? So transparent or opaque. And another characteristic, it can be with filter or without filter. Okay, now filter is to remove the odor. Filter that is usually attached to the colostomy bag. Here, okay, the black color is carbon filter, or you call it charcoal filter. Okay, so this is introduction about the one-piece pouching system, and it can be described as drainable, non-drainable, transparent, or opaque, with filter or without filter. So see what is the patient's choice. Next is the two-piece pouching system. So when two-piece pouching system comes to you, you must remember there will be two parts. One is the base plate, or you call wafer, right? Another one is the bag. So the patient will wear the base plate for longer period, maybe 3 to 5 days if it can attach well. But then the bag can be detached and drained, detached and washed and reused. So this two-piece pouching system, it also comes with drainable and non-drainable. So as you can see here, this is non-drainable or closed end, and this is drainable. Right? It is not the same as one piece because the base is detached from here. And it can be transparent, like this. Transparent. Okay, so, sorry, this is transparent. Transparent. Okay, two pieces. Transparent. Or it can be opaque, like the one that shown here. Then it can be with filter, this is filter, or without filter also. Okay. Another thing to introduce to you is the stoma cover or stoma cap. Okay. So stoma cover, well, it can be one piece as well. That means that patients remove everything and then cut the hole and fix on it. One piece, right? Or it can be two pieces. So the base is still there. Only remove the bag and then put on this cap. So when it is used, so this is usually for patients who has undergone the surgery for some time already. Some of them the bowel already trimmed, and the discharge can come out in a more regular interval. Right? So in this case, a patient can go for swimming, can go for can do other sports or what by without having to carry the whole bag. Okay, right. So this is a temporary covering onto the stoma. Right? Okay. So we talk about the bag, the pouching system. Then now this is the care accessories. So sometimes patients encounter some problem, and we are going to go through some common problems. Okay, that the patients encounter and help them with this. So what can help? Okay, in treating the common problems. So you have all these products here. Okay. I'm not here to advertise any of the product or the company, but you may take a look later on at this exhibition table, the display here. Yeah, I have quite a few products here, and it is with label. Okay, so later you can come and visit this table. So look into accessory, the care accessories. So basically, it contains the skin barrier, so help to protect the skin. Okay, right? The skin barrier can be in a wipes, type that's white, or can be in spray. Right, spray. And then or stoma paste, stoma paste. So stoma paste, okay, the texture is like toothpaste. And so it is to use to put surrounding the stoma because some patients here the skin is uneven. Okay, skin around the stoma is uneven, and when you want to fix the bag, you find it difficult to stick properly. So you may need some help. So you can use stoma, the paste, the stoma paste. Okay, stoma paste or the stoma ring. Stoma powder. The powder is to put on to the skin excoriation part. So to help to make it drier and also can have some antiseptic effect. Okay. Tail closure. This is tail closure. So click adhesive remover. So if the baseline is stick on the skin, very difficult to remove it. So we use adhesive remover. It comes in with spray. It comes with wipes as well. That means also to detach the old bag, right, without causing a lot of injury, without causing a lot of distress, okay, to the patient. Protective barrier wipes. So protective barrier wipes and skin barrier is the same, but this is in the wipes. Ostomy appliance belt. So this is the belt to help to stabilize the bag. So for example, if this patient is going to do some activities or maybe some clothing that need to adjust, they make some adjustment to make it fix properly, more secure. So ostomy appliance belt. I have all these care accessories here. Put on, right? Okay, so you know about the appliances, you know about the pouching system, one piece and two piece, right? Then the storage of all this. So how are you going to educate your patient? If you have all this at home, you need to keep it in a cool, dry place. So keep all equipment together. There are a few things need to be used together. So don't let it scatter everywhere. Then you have to find one by one each time you need to use. So keep it all together in one box, and then you can keep it on top of the shelf or inside the drawer. Assign a specific area, easy to get. Cool, dry place is the key to it. So remember, do not expose to direct sunlight. The bag made of plastic. This material, hydrochloride, right? So it can become sticky. It can become damaged if exposed to sunlight. Do not keep in the bathroom or toilet. Thinking that easy to use, so put in the bathroom, but that is no good because the environment in the bathroom is humid. So can grow bacteria. So don't keep in the bathroom or toilet. And ordering supply. So if I'm running out of stock, where can I get this? So you can get it from pharmacies. Many of the pharmacies sells ostomy appliances. So you can ask the patients to shop around and see, compare the price, because it's for long-term use, right? So so can buy the cheaper one if the quality is the same. Okay? And can get it from medical supply distributors as well. So the medical supplier that supply the appliances. Okay? And can buy from internet. So you buy from internet, that means online shopping. Lazada, Shopee. Okay? Right. So from all these sources, the patients can get the supplies. And it is advisable to reorder the supplies several weeks before it running out of stock. Because sometimes you go to the pharmacies, they may not have the ready stock for you. Right? So you also don't, the patient also don't use until the last piece. When it is going to finish, okay, so then can go start shopping for it. And if it is ordering online, so it takes time for delivery. So remind patient on this point, so that the supply will not be discontinued. Okay, right. This is also taking care of the quality of life of patient, because it is not controllable, right? The disease coming from here. If I have no supply, then I will get very anxious. Do not overstock the products. So overstock. So I'm worried that I'm running out of stock, so I buy boxes and boxes. So there's no good, because all the products will have a shelf life. Shelf life. Okay, shelf life means that it will be good to use within this period of time to this period of time. Okay, and then also it can be if you have so much of stocks, you keep too many stocks, and then it will be you have risk, okay, to get damaged because of the temperature, in, or the heat and humidity. All right, okay. So later on, you will come to this table, and then to have a visit to all the appliances and also the care accessories. Right? So get to know you more. You can take pictures. Okay, on this thing. Next, we move on to the management of common complications. So if I'm a patient, right, so I have undergone this surgery. No, now I ended up with a stoma on my abdomen. So how to take care? So I need to learn, okay, the skill how to change the bag. I need to know where to get the bag, right? And then how to store the bag. So then if there is complications, minor common complication, I need to know how to manage it. And no need to go to doctor all the time, every time, right? But it's severe complications, like what kind of condition, then I need to go to seek medical treatment. So this part we're going to talk about that. Okay? All right. So peristoma skin problem is the most common complications. The leakage of the effluent or the outflow can damage the peristoma skin. So when we say peristoma skin, that means the skin surrounding the stoma. Alright? Okay. But anyway, prevention is always better than cure. So you have the knowledge with this, then you must teach the patients to prevent peristoma skin problems. And usually, these irritations to the skin is very much related to improper fitting of the passing system. They don't fit properly and it leaks. Okay, poor adhesion. So you fit already, but it doesn't glue in properly. It doesn't glue on properly. Okay, so it tends to leak and irritation from the adhesive. So this is something like allergic reaction. Okay, contact allergic reaction. Okay, so peristoma skin problem number 1 is skin breakdown. Okay, when you see skin breakdown, then you can see that the skin becomes not even. and you can see sore and bleeding in surrounding the stoma. Okay, now the causes is including leakage. So leakage and the enzyme will then damage the skin and causing skin breakdown. Okay, the causes also include allergy, especially this one you can see there is a shape, so it's very much like allergy as well. Okay, and then infection, radiation, or skin stripping. That is why certain people, right, we need the skin the adhesive remover to help healing of the ostomy bag, because to some people who has very fragile skin, when you take it out and you may strip the skin and causing bleeding. The treatment of it, okay, identify the cause and correct it. See, it is due to allergy, it is due to leakage or what. So identify the cause first. So and then check about the reason why is it leaking. Is it because my bone here and I have grown very thin, so cannot fit properly? Or is it because I do not cut the hole or the opening of the base plate properly? So identify the reason for the leak. Change the wafer as soon as it leaks. So when there is leaking into the wafer, teach a patient how to take note of it, how to notice that, and then change it so that the fluid will not, or the output will not trap in between the wafer and the skin. Make sure the cutting is at the right size, and take note that the stoma may change size and shape after surgery. So initially it may be bigger, later on it will shrink. So if you continue to cut the same shape all the time or the same size all the time, then it can be too big. So sometimes has to be minimized. So this picture shows folliculitis. Folliculitis means infection of the hair follicles. So removal of hair from its follicle forcefully resulting in irritation. So if patient is heavy and you strip off the hair, then you cause some injury, and bacteria can sit in there and cause infection. Okay, so it will appear like that. Okay, folliculitis. So the treatment is shave the hair using the electric laser, and you will not. This is to reduce the risk of accidental stripping on the skin as well. Okay. And doctor, okay, go to the doctor because you need medication now, and the doctor may order corticosteroid cream to reduce inflammation. So it's either cream or spray. Candida infection. So candida infection is fungal infection. Many of the patients are prone to have fungal infections because of low immunity. Okay, fungal infections is an opportunistic infection as well. So the treatment first will apply the corticosteroid spray, then wipe off the excess. After that, second step, apply antifungal powder. Okay, so this is the way and the common way of treating this. But you have to tell the patient she or he also has to go to the doctor to get the prescription. Alright? Okay, allergic contact dermatitis. This is the stoma. This is the shape. You can see the shape. Right? So it is caused by tape, allergic to tape. It is caused by skin barrier material that you put on, or it can be caused by the pouch, especially pouch that is closely attached and deeply pressed on it for some time. So you call that contact dermatitis. Okay. So in this case, treat the inflammation first. Then after that, adjust the appliances to avoid recontact with the affected area. You know that it can be due to the tape, can be due to the pouch, can be due to anything that comes into contact with it, right? Each individual, they're different. I may be okay with this brand, but not okay with another brand. So identify it. So after treating my skin problem, I have to think of making adjustment, not to use these appliances. After that, try another brand, okay, or another time. Okay, the last peristomal skin complication, epidermal hyperplasia. So epidermal hyperplasia, opening of the wafer cut too big and causing prolonged exposure to the urine and moisture. So that means that urine that it comes from urostomy, right? Urine that come out from here, right? Get into contact. Urine is very liquid, right? So it's quite difficult to take care. Okay, so have to properly re-measure the stoma and apply the pouch with proper opening. The size, the shape have to cut properly, fitted well, and this so that to prevent leakage of urine that cause prolonged exposure. Okay. Okay. Other complications, this is severe hernia. So hernia, the abdominal wall has become very weak, the muscle weak. So not only here, you can see this is the surgical opening that they created, but other intestine also come underneath. Okay, so this is called hernia. This is called prolapse. Prolapse usually it's due to increased abdominal pressure. Patient have to take care. Certain activity has to be restricted, especially immediate post-op. Right. So if straining so much, carry heavy things, then the stomach can collapse. So coming up. So retraction. So retraction means go inside. Stenosis, narrowing. So the doctor create a hole, but then later on, then it become narrowing. Okay. Then infection. So you can see not only feces coming out from here, but pus discharge as well. So this is infection. And whole thing turned black. So this is necrosis. Lack of blood supplies and then cutting of blood supply. So not able to function anymore. Okay. So this will require urgent necrosis. For peristomal skin, there are some ways to prevent the problem. First of all, the correct size is very important. If you were to cut, you do not cut more than 1/8 inch larger than the actual stoma. So now we usually don't go remember 1/8 inch. So we say not more than 1 to 3 mm. More than 1 to 3 mm. So cut the correct size. Change the pouch regularly to avoid leakage. Not to let it hang too heavy. Then to tear off. Okay, you tear off the base plate, then it can cause leakage. Right. Remove the pouch gently by pushing the skin away from the pouch. So remove gently. You have to use hand counter traction. Okay, don't pull too fast or too hard. Keep the skin clean with water. If you want to use soap, then you use mild soap. Okay. So clean the area properly, and then after that, dry the surroundings too. And this can be done in the shower tub, meaning the patients can go shower, okay, with the stoma exposed to water. It is alright, okay, it is alright. And another care, okay. Another way to prevent is to observe the stoma site every day. Look at it so that you can detect the earliest change of skin. So when the problem is minor, then quickly correct. Okay, so if there is allergy, then can detect it early as well. Another problem, intestinal gas. So patient, the flatus come out from the stomach here. So early weeks and months after the surgery, the patient may experience excessive gas. Okay, the gut science start working on it and trying to adjust, okay, to this new way to work. So, but then it will become lesser. That means the gas will become lesser when the bowel heals and when the patient has already resumed regular diet. Okay. So to help prevent excessive gas, there are some things that you can tell the patient. So eat in a relaxed atmosphere, chew slowly and thoroughly for the phone. Right? Do not take carbonated drink because it produces gas, and also chewing gum. So chewing gum also can produce gas. So if patients experience excessive gas, so don't take chewing gum. Carbonated drink, chewing gum for those old ostomies, they can take it, but in moderate amount. But initial alcohol definitely it is no. Certain foods like cucumber, cabbage, okay, the cabbage family, broccoli, onions, fish, dried beans may cause intestinal gas. So identify this, especially the cabbage family. Okay, this can produce more gas. Large amount of vegetables or sweets also can create gas. Constipation or unsatisfactory irrigation. If the patient practice irrigation, which is we seldom do now, right? Irrigation means putting in water and then to flush it, to train it so that it can have a regular bowel intervals. Okay, so but constipation can also cause excessive gas. To muffle the noisy discharge of gas. So gas come out from here and it creates noise. You can make the patient feel embarrassed. So you can teach the patient put the hand is over the stomach, and the next thing is eat regularly. Eat regularly, when the wound has totally healed, when the functions has come back normally. So regular diet and avoid gassy food. Don't say starve for too long and then after that take a lot of food. No, eat at regular basis. Intestinal gas now is the odor. Odor is the bad smell. Bad smells that comes out from here make patient very upset. So identify what types of food that can produce bad smells. So usually it comes together with the types of food that can produce intestinal gas as well. So the cabbage family, the onions, right, and eggs and fish. Okay, so if I want to go for a social gathering tonight, then today I make sure that I don't take eggs. Right? Some medicines such as vitamins and antibiotics will also can cause the stool to have problem. We know, isn't it? You take anti-clots and ampicillin, and when you go to toilet, right? Then you can have the smell from the stool. Okay, the other management include how to take care of smell, right? Deodorant drops in the pouch. So taking out the pouch and then put in some drops. This one is in sachet, so it comes in bottle as well. So pouch opening, clean already, then drop some inside. Okay, besides what we have earlier on, the pouch with the carbon filter. Okay, carbon filter. Okay, so this one also can help. They can help to reduce the bad smell. Okay, next is the problem of constipation. Now, constipation, so identify first what causes constipation. Unbalanced diet or too small the intake. So this patient maybe has some problem, okay, no appetite. So the problem is not maybe not related to the stomach, but it's just that he has some flu, fever, and then no appetite, so taking small amount. So this can lead to constipation as well, and certain medication. Okay, so some patients will have to take other medications besides the problem with the ostomy. They do not use laxative to treat the constipation without prescription. Okay, it may be overused and then patient can turn to become dehydrated. So always see doctor to get prescription with constipation. Diarrhea. So diarrhea also can be a sort of problem. But when diarrhea happens, it says here what? It usually is a warning sign that something is not right. Diarrhea. So, but then it has to be distinguished, okay, from the nature of the output. You must know that this is diarrhea. This is not because of the stomach is at the ascending colon or at the ileostomy. Right? A well-balanced diet and sufficient fluids are required to obtain good output. So good output requires well-balanced diet, requires sufficient fluid. Okay, so adjust the diet, take well-balanced diet, and regulate it to see first. Is it an effective diet that you have to see doctor, or no, because of the problem of intake? Okay, then next is the phantom rectal sensation. When we say phantom, it is related to the word not real. Not real. So it says here similar to the phantom limb. Patients after amputation, right? So may feel that the legs is still there. So that is called phantom. For ostomy also the same, especially beginning of the surgery, or sometimes it may last for a longer period. Then they feel, okay, they feel that the sensations of wanted to go and pass motion, even though the feces is bypassed. Okay? So whether the rectum is still there or no rectum already removed, or patient can have this sensation. And there are patients saying that after they go to toilet, they sit there, even though not much discharge coming out, but they feel relief of this sensation. So believe in what the patient says. Okay? Alright. So next is when to seek medical assistance. So you go through the complications of stomach care. You identify it, and then some common minor complications, you know, how to treat it. And then now, when to seek medical assistance. You need to tell the patient. Severe cramps that lasting more than 2 to 3 hours. Something is not right. Abdominal cramp 2 to 3 hours. So in this case, must go see doctor. Okay. Unusual order that lasting more than a week. So you check and you know, you have the knowledge of the what food can produce odor. So you avoid that, but it's still very bad smell. Okay? So maybe there is some disease part or cancer or whatever, some unknown discharge inside. So have to go see doctor. Unusual change in the stomach size and appearance. It should be opening like a mouth, but unusual change in the size. So if it collapse, it becomes so huge, or if it retract, so this needs to see doctor. Obstruction at the stomach, or collapse of the stomach. Obstruction means becomes stenosis. Right? Excessive bleeding from the stomach opening, or you can see that the bleeding discharge is collected in the bag as well. So this is considerable. Need to see doctor. Severe injury or cut to the stomach. So maybe not careful, okay, accidentally hit something or what, so hitting on the stomach, and there is a cut, there is a injury. So must see doctor. Continuous bleeding at the junction between the stoma and skin, so surrounding the stoma, if there is continuous bleeding, right? Watery discharge that lasts more than 5 to 6 hours. So the patient is purging and then very watery the output. Patient will suffer from dehydration, will suffer from electrolyte imbalance. So don't let it last for too long, right? So if it lasts more than 5 to 6 hours, then have to see doctor. Chronic skin irritation, use the care accessories, the cream, the powder, but it is still repeating, so need to see doctor to seek further treatment. Stenosis is narrowing or unable to wear the pouching system for 2 to 3 days without leakage. I put and then you dip again. I put and dip again. So there might be something inside, okay? Or the skin will become unable. There may be a growth underneath. So must see doctor. Okay? So with this, we finish with the module 1, and these are the references. Okay? Ostomy needs a lot of reassurance, and the preparation is right before the surgery. Care is continued from before surgery, after surgery, and continued care. So all this link, okay, can show to the patients. They can find very helpful information from the internet, and usually this is run by a volunteer organization to give tips, self-care tips to patients. Okay? So we shall have a 10 minutes break before I proceed to module 2. We have finished with the module 1. So the facts for ostomy care and also the facts for ostomy and also ostomy care. Now we are going to module 2. So module 2 is a practical session. So before we start on to do the hands-on, and let's go through some slides and also video. Okay. So module 2 is application of colostomy bags. I put this in more specific colostomy bag because we are now dealing with a patient with colostomy. Okay? Right. So at the end of this module, the participants will be able to demonstrate the 7 steps application of colostomy bag according to the procedure manual. Now, 7 steps is very fast, right? 7 essential skills. So I will show you the steps and then help you to remember the 7 steps are the important one, and this is applicable for the one-piece pouching system. So you were expected to use the colostomy bag that is given to you on your table to do a real cutting, right, and then fit on the stoma that is given to you. Each of you will have one stoma. So you're going to fit it correctly and then show it to me. Okay? So the assessment will be for the application of the one-piece pouching system. For the 2-piece pouching system, you learn component skill, meaning you're going to do the opening and also the detaching and also fixing on the bag for the 2-piece system, and then open and close the clamp properly. Okay, so the 2-piece system, you know, you to cut and apply the whole thing because the basic principles is the same as the 1-piece, just that you are going to cut on the wafer only. Right? You have to learn how to fit it correctly and also clip the tail of the bag. Okay, so first of all, the preparation of equipment. So you have the top trolley and the bottom trolley. So the top trolley, you have dry tissue paper. It is for you to use, okay, when after cleaning, so it's a little wet, isn't it? So you dry it before you put in the new bag. Then you have wafer and also the two-piece pouching, the two-piece colostomy bag. So wafer will come together with this. If this is a one-piece system, then you do not require the wafer. You take the one-piece appliance. Measuring guide, right? So there are two ways you can measure the size of the colostomy. So this is measuring guide that helps you to fit into the and measure the size of the stoma. Or otherwise, what you are going to do later on is using the plastic clip, okay, and measure and do the cutting. Okay. Then you need a marker pen. So every one of you has got a marker pen on your table, a curved scissors. So if you don't have curved scissors, then ordinary scissors is okay, right? But curved scissors will be easier to trim the and to make the opening nicer. And tail closure. So this is straight tail closure. The bottom trolley you have measuring jar because you need to measure the output, especially if this is ileostomy, ascending colostomy, right? So it is very watery, the output, so you need to measure. And an ordinary receiver, for you to receive, let's say I am changing the bag, only I don't change the base plate for two-piece system. So this one I'm taking and putting it here. Later I bring to toilet to wash the bag. So to differentiate from another receiver, which is for clinical waste and to throw it away. This one you don't want to throw. You want to take the patient's bag and wash, and then after that, use an S-book to dry it when you are applying another one for patient. Okay? Remember the two-piece system, the bag is reusable. The water is to stay there, okay, ideally 3 to 5 days. Okay, that is the ideal way. Then you need a disposable glove. Yes. If self-managing or ostomates that they don't use gloves, it's their own body discharge. But if you are doing for somebody, caring for somebody, you need to wear gloves. Okay, this is touching the patient's body. Then you have a Macintosh or Inco pad. This is the protective lining to prevent soiling of the bed sheet or the food. Hand sanitizer. So in between, we need to sanitize my hand. So can you tell me this is a sterile procedure or a non-sterile procedure? A non-sterile procedure. Okay, so the cleaning method is to clean the stoma, clean the peristoma skin. So clean the stoma, pick up the feces, clean it nicely. Clean it nicely so that it won't smear everywhere. Clean it correctly in the way that it is clean, okay, after the process of cleaning. And do not need to follow any sterile technique. It's not sterile procedure. Huh? Alright. One-piece pouching system is the one that you're going to demonstrate. I'll do the written demo later on. So the step-by-step guide, you have 7 steps. First, prepare means you gather all your equipment with you. And so you can check now on your tables. Yeah, you have the stoma, you have the bag, you have the scissors, you have the marker pen, right? All the equipment. Yeah. And then remove the ostomy appliance. So you prepare the things already, you go to patient first because you want to change the bag. So you remove the old ostomy appliances. Anyone can tell me when removing the appliances, you remove from where to where? Top and bottom, so which one to come first? Top first. Yeah. Top, you remove it so that you won't let the contents spill over. If you remove the bottom first, then it will spill. Okay, so remove the ostomy appliances from top to bottom. Clean the stoma, clean the skin. Okay, add, remove, clean, and then after that, measure the stoma size. want to fit the new bag, so you measure. After that, you cut. So you cut on the plastic sheet that given to you, and you measure and cut on the stoma bag. Cut two places, and after that, you check the hole size. So after I have cut, then I check again on the hole to see whether the size is okay or not too small. I can trim some more. Then apply the ostomy bag. When you apply the colostomy bag, it's supposed to be top to bottom or bottom to top. Bottom to top, so that you can easily take care of what is below, then slowly go up to the top to ensure a well-fitting bag. Okay? Alright, so let's take a look at this video now. Sorry if I So we are watching the video of the one piece system. The detection that often the detection that if it is semi-solid, then you will measure it as a small amount, moderate amount, large amount. And here, if it is you don't allow it, define or measure. Okay, otherwise, okay. Then after this, I will clean the pelvis. So use the wet tissue to clean the thoroughly clean and observe it. So look at the stoma, is it healthy, pink, moist, and functioning? Right? Functioning will be present of latest from time to time of the pieces coming out. If it is too bad, I will. Okay? And after that, cleaning already is going So this is towards patient's A. So I will write today's date. Towards patient back. Tracing. Okay. If I cut too big, then I cannot save it on it because it will be spoiled. If I cut too small, I can further trim in. Okay. So be very careful in cutting. Okay, alright. Okay. So now I have my new bag. So this is front, this is back. Okay. So because I take it on this way, this is the eight, so I'm going to do it this way. Then you forgot it and you this become like this. Okay, use and on, take it this way and do that. If the shape is not exactly round, you can fit it out. Okay, take it this way, right? Okay, so then you already get the cut from this tracing paper, so you make the hole in the center. Now you are drawing on the patient's colostomy bag. I have to put in some air so that I don't accidentally cut here. I put it again on the L colostomy bag. So with this now, and with the fix. My patient can walk, I will put it upright. So, and in some bag you will have two parts. So this one only has one part. So you got to be very careful with this one part because it can become comfortable with it. Then picture now you remove or stretch a little bit on the skin. Okay. And after that, slowly okay. So with that, we fix it. So this is about changing on the colostomy bag, which is any questions about this? And next, next will be the two-piece pouching system. So the two-piece pouching system, you know that your requirement will include a wafer and also the bag, because the wafer is the area that you're going to cut, and then the bag, later on you're going to practicing on it, each individual, or you have a set on it, and so you're going to practice fixing it and taking it out. So there you will make sure that you are able to fit it correctly. And next thing that you are going to practice is also about using the clamp. So you have two types of clamp or two types of tail closure on your table. Okay, one is the straight, it is the straight shape. Another one is the curved shape. So fixing of that. So fixing of that. If this is already on the patient, so it will be like this. So you are going to open up the tail closure here, and after that, put it in this way and close it one layer. Okay, only one layer. You close it. Okay. You do not require to fold 2 fold. Only you are to make 1 fold. Okay, 1 fold only. If you put 2 folds, then the clip cannot work properly. Okay, so remember, keep only 1 fold, 1 fold, and you must hear the click sound to make sure that it goes into it and lock. All right. So, 2P system. So step-by-step guide. So initially, you do all the preparation. Whatever that you require, then you gather together. Then remove the ostomy appliances. So same thing from top to bottom to prevent spillage. Right? And then after that, you clean the stoma and also the surrounding skin. So clean with the wet wipes also can. Right? So clean with soap and water also can. So clean, and then if it is wet, then you have to get dry. Then measure the stoma size. So measure with the measuring guide or measure with the plastic sheet that you have, and you draw, measure. After that, you cut on the plastic sheet, and then you cut on the wafer. So cutting on 2 things. Check on the whole size, so check again. Then after that, apply the wafer. So when you apply the wafer, you make sure that the patients you stretch a little bit on the skin and then make sure that it is even. After that, you clip the tail closure of the pouch. So you prepare your pouch first by clipping it, then only you attach. Because remember, the output of the stoma is involuntary. So if you don't close these ends and you fix while you are fixing and exerting some strength here, and then maybe the stool starts coming out. Okay, so you close the end first, then only fix. And when you are fixing the pouch, you fix from bottom to the top. And make sure you press on it to hear the click sound. Alright? So I'll show you the video of the whole process. So this is clear trolley and whites. Okay, that whites tissue and then some other people. Okay. And because this is 2 piece, so this is the paper, right? The correct size of paper, and then the bag. Right? And you must have a plan also. You must have the scissors and a marker pen because you are going to draw trace the stoma size. Okay, so tracing stoma size is very important. Right? So, and this is the curved scissors. This is the scissors curved. If you don't have the curved scissors, it is fine that you use the ordinary dressing scissors. Right? But curved scissors will help you to cut. Right? In the bottom, hand sanitizer, and you have a Macintosh or eco pad support, and disposable gloves, you have a measuring jar. If the output is semi-solid, HD, then in your report you will write small amount, small amount. If the output is very big, okay, then you have to point to the jar, measure how much, and write it. Okay. Then you have 2 receivers. This is of clinical way. Whatever you want to throw, you put here. This is not to throw because the bag is reusable. Help you to remember. End of the procedure, you're going to bring this to the toilet and then you're going to wash and you keep walking. For the next, right? And then patient may call you to say that you leave, or you may notice it and you keep patient. So now, good afternoon. I'm student Sarah from Colostomy Bag. I'm going to help you to change. Change, and then change to back. Okay? Back to you. After the domain, you got animals, many of the things are like visual design. And together all together, right? So that is it will be more organized. Okay, then positions you again. Either location is my position. After that, you okay. If the tongue is dirty, then you have to change. Okay? Make it in a way that it's not, it is near us, able to handle it properly. Just the one you stay is really important. Keep pouch below. Then you take out your receiver. Oh wait, this is you to take the item test. And then take the measure from that. Okay. Because I want to do the cleaning, so I get ready. Back tissue. So I get ready back tissue. And I start with so let's say this is watery stone. Okay, so open this. Here and then end of the day, use the traditional three here. And for the reason now I will detach it. So I'm going to take off that. I'm going to detach it on the top to bottom. The top to bottom. Okay? So what I do so then now I take the wet tissue and I clean the stoma. So I clean the okay. For cleaning, I like to stop mine. So this is the paper. I open up and I take the plastic. And now I'm going to do a measurement. This is the so the arrow towards the head. So this is 17.6. Why I write it is sometimes in the beginning it swells up and later on it will shrink, become smaller. So I have to take note about the size is there. Okay? And then after that I start to trace the size of the okay? So I trace it. And after that I take a wet tissue. Because of functioning stone, having presence of stool. So before that, actually, I also check whether the stoma is clean, moist, okay, healthy, and functioning with presence of ethers or presence of stool. And the peristoma skin, whether there is any examination. Really cutting. Later on, we are going to do the cutting. cut along the mark. And after that, I'm going to take paper and see because just now I placed and this is like that. So I have to put it this way. Just up and up. Must be the same position. Okay, so we will. After that, you make the hole at the center. When I want to put along here, I should try the angle. So that the same. First, I eat, then I smooth it. Okay, make it smooth. Check. Okay, okay. Then now I fill on one part of the cake. Arrow is here, so I must follow. Arrow is towards the patient. Okay. See. Then I smooth the area. So go to make it stick on it. So go down, massage for 30 seconds. Okay. Then after that, I peel off another arm. Okay, make sure there's no air pocket, so inside out. Then another side. Fine. We know with most of just use it to motivate and make it stick very well. Alright? Okay. So this is how you place the paper with the arrow towards the patient side. Let's take a new breath. Then I clench first. Clench. Okay. Then now I have to decide if my patient is able to walk, then I will put it upright. If my patient is bedridden, then I will put it sideways or even. Okay? And so I will fix from bottom to top. Right? So now I ask Madam Susie, can you please harden your abdomen? Harden. So it's easier for you to fix from bottom and slowly cover until the top. Okay, then you must go around the ring, ensure that you hear quick sound. Right? Go around and after that, click and check. Make sure no leaking. Leaking of feces make patient very depressed. Okay? So make sure. So it's all fixed already. Okay, so it is done. Patient. And then clear away all the things. Measure. Take a whole breath to the toilet. If you need to measure, then you will measure. And after that, you rinse through, you clean it, use the expo on it to try it, right? And remember, don't accidentally throw away the cleanse also. So this one is so warm, so right? And keep the patient fit. Okay? Then after clearing everything, then medical hand wash and do document. Yeah? Any question to ask? C. So the two-piece counting system, the cutting on the left. Now we come to activity number 1 here. So we need to do a written demo for application of one-piece counting system. So you have all your equipment ready. This check, so you are going to do it together with. Okay? So what is the first step? Here. Put this one and this side. Okay, so prepare and gather all your equipment together. Then next is remove. So how are you going to remove? From top to bottom. Just now in the video, top to bottom is like this because the patient is able to walk. So bottom is always the back side. Okay? Now this patient cannot walk, so the back is put sideways. So I remove it top here to bottom to avoid spillage. Okay? And after that, so if it is disposable, you check on the spool. So next one is sorry. Back wipes also can, back cloth also, mouth soap also can. So, clean the stomach, clean the back. Okay. Next, what do you do? Ensure. I'm going to use the plastic one that I have to use. I'm going to do okay, stomach. So now you measure. Put it near the first of all, write arrow. So assume one side, arrow on your stomach. That is the head. Then after that, write today's date. Everybody can? Yes. So today's date is 20th of April. So then measure on it and use the marker pen. So you use your marker pen to trace. Okay? Okay. Trace, make sure you put the arrow and the date. Okay, next is to cut on the plastic sheet. So you cut the whole, cut the opening that you measured just now. Everybody is doing that. Good. Okay, cut and you check whether the size is okay or not. trace it on the colostomy bag that you have. So remember, so you see, as I remove it from here this way, my colostomy bag is going to put on top. Okay, on top of it. When you turn it over, the deck is supposed to be in the opposite way. Try on this first. Everybody get the correct size? And okay, so trace it on the colostomy bag. Trace the size. Right, good. So you have placed the size on the colostomy bag. Now you put in some air into the just a little bit of air will do so that it won't attach together. Right? Then you cut on the colostomy bag, one piece colostomy bag that you have. Clean the opening, following the shape, and remember, you have allowance of 1 to 3 mm. You cannot cut too big. If it is too small, doesn't matter, later you can trim again. So now make the cutting on the colostomy bag. Okay, good. So cut and twist again. Make sure the size is correct. Remember, before you put the arrow, you have to decide, if the patient can walk, then you put it this way. Okay, put it so that it hangs down. The patient's walking. If the patient cannot walk, then you put it sideways. Alright? Alright? So now the next step is you are going to fix the bag. So remove the backing paper. So this kind of backing paper is only one piece. So remove it. Through. And take onto the colostomy bag. And smoothen the adhesive. Very nice. Fit nicely. Good. So this disposable one-piece system. It comes with the backing paper. When you remove, you have to remove the whole thing. Some of it got two parts, as you see in the video. So if it is two parts, it's easier for you to settle one side first, and then after that, settle another side. You do not want to have wrinkles, okay, on this adhesive plate when you are putting on it. Okay? Everybody done? Done it? Or give yourself a Good. This is about the one-piece pouching system. Next. Practice the component skill for the two-piece pouching system. The component skills that I want you to practice is one, you have your two-piece system on your table. So you're going to apply and then remove. Apply and then remove. So when you apply it, tell the patient, harden your abdomen, then you apply, then you click. Make sure you hear the click. When you remove it, you remove from the top to bottom. So do this a few times for one component skill. Another one is open the clamp and then close your clamp. You must make sure that each time you're familiar with this, and each time you are only allowed one fold. Okay, and then it will be clip or closed properly. All right. This one is mistake. Feel free to ask questions if you have any doubt. Make sure you find the click sound. Okay? All of you now able to fix it well and hear the click sound?
Yes.
Sometimes it's a little harder. So harder to fix it and hear the click. Especially if the patient don't harden the abdomen. So when the abdomen is soft, then it's hard for you to press on it and to hear the click sound. So you may also tell the patient to bear down. So bearing down is like going to toilet. So when they do bearing down action, the abdomen automatically is harder. Okay? So things to remember when you apply from bottom to top. When you remove from top to bottom. When you apply, you have to check and press on the ring so that you can hear the click sound. After that, you check again the surrounding to make sure that it cannot be detached. Right? Okay. Any problem with the tail closure? Alright? So the tail closure, you also will have a click sound. Right? You also can hear a click sound. So make sure, sometimes the patient thinks that, oh, they took two fold so that it is more secure. Cannot. So you must teach your patient you cannot put two fold because the clip is meant for one fold only. So if they think that two fold because we can prevent leaking, then that is not true. This clip can give way, and then after that you will leak when the bag becomes heavy. Okay, so only one fold, and then after that clamp it and make sure you hear the click sound. So this is what you're going to teach your patients. So all right, with this activity? Yes. Okay. So let's proceed to the last activity. Okay, the last part is actually working with you again. Now, this changing of ostomy bag is performing on a real patient, and that is why the video recording is taken and then the sound is turned off. So you can't hear anything. That is normal, cannot hear anything, but it is performed on a real patient. Okay, look at the consistency of the stool. Try to locate where is the side of the stoma, right? Whether it goes with the consistency of the stool or not. Okay, and it is changing of the ostomy bag, which is using the two the two-piece pouching system. Do you notice that the side of the stoma is right side or left side? Right. So right side, so you expect the output to be more water. So it's quite watery, it's quite a lot, yeah? This could be descending, colostomy, or okay. With that, you complete with the YouTube. Stretch yourself. You just sure. Okay, let's take 5. If you want to go further, then Okay? Okay. Getting ready. So this is the last module, already module 3. Yeah? So module 3 is about living with ostomy. So this is about how you gain the knowledge already, you learn the skill already, and then how are you going to help the ostomy to live a meaningful, productive life. Okay? Right. So at the end of this module, participants will be able to explain the self-care management of an ostomy to live quality life. Then state the purpose and function of stoma care support group. So I'm going to introduce to you also the stoma care support group, and so that you can tell this information to the patients, okay, in order for them to get support, right? Okay, living with colostomy or living with any of the ostomy. So this is a major change in life, same like any other major change. Right? Some people experience it like a crisis. So because part of the body has no longer has its way to like the way the nature has intended, meaning the patients cannot pass motion, so cannot pass motion like normal people do. Okay? And they may feel discouraged, they may feel frustrated and isolated from others because they feel that they are not normal, right? And this is normal feelings of the ostomies. So identify it and acknowledge that. Okay? If the patient will ever tell you anything, then you say it is okay to feel like that. It is normal because they need some time to get to adjust it to the new situation, right? And that is why the ET nurse they start preparing the patient right before the surgery. And when they come to visit the patient for the first time after surgery, okay, usually it's maybe 1 or 2 days after the surgery, patient is more awake, and they are going to do the first changing of the colostomy bag. So during that time, they will use a mirror and ask the patient to look at the stoma, and then after that, hold the patient's hand to touch the stoma. The patients must have self-acceptance, right, in order to go through these difficulties. Talking to a trusted friend, nurse, clergy, or certainly another person with ostomy, that means talking to another ostomy, will give will discover new hope and encouragement. So encourage them to verbalize their feelings and then encourage them to talk to others. Keeping a secret will make the patients more influenced. Okay? Positive outlook on life and patience with a sense of humor. So this is the key to success. So we know we can say that quite easily because we are not the person, but we try to show empathy, okay? And we also bear in mind that the patients need time. Okay? And can find support group through the internet. So this is one of the websites that you can have a lot of information. And it is free access, the guidebook, okay, and also how to get adjusted to the new way of living and all this. So all this information can be downloaded as PDF and it is free. Okay, so you may learn more, okay, by going to this website. You can also teach your patient, show the access to your patient as well. Okay, so how to live, okay, with an ostomy. So from one aspect to another aspect. So first of all, we say telling others about the surgery. Patient may be sad, maybe hard to accept, okay, even though has prepared before surgery, but then you tell the patients, or you make the patients realize, or the patients may already experience it, and tells you also that even though I don't want to talk anything, but people will come to me to ask. When I go back from my surgery, friends will ask, neighbors will ask, relatives will ask. Okay? So friends and relatives may ask questions. So you can tell them as much as you want. So as long you can tell them it is okay, but it's up to you who you want to tell, who you don't want to tell, and you can tell as much as you want. Okay? Use simple explanation. You have to tell in very detail, right? And a natural way to this is telling others is a natural way to dispel any misconception. So if people are ragu and then gossiping behind, it will make you actually more upset, right? So simple explanation. So you also see to the patient whether they have come to this level of acceptance. You don't force. Don't tell people it is not that way. Okay? Alright, then next, we see to the aspect of clothing and appearance. Why are we learning all this? Because we want the patient to live a normal life like before. So actually there is no need to purchase special clothing. Right? But there are some minor adjustments that need to know so that the patient feel comfortable and also maybe according to patient's preference. Okay? And avoid tight waistbands directly on the stomach. So this is the key. If you wear anything, either a pants, a skirt, or so you don't let the waistband directly press on the stomach. The area for output, you need to put it on top or below. Then there's no problem. Okay? So you see, look at these pictures, they can wear like ordinary clothing. Okay? Nobody will know. This is specifically tells you the patient has a hidden colostomy bag, so can wear this kind of this kind of clothes. So this kind is considered loose fitting type. And if the patient wants to wear vital shorts, also can. The colostomy bag will be hidden inside, and make sure that the waistband is not pressing directly on the stomach, but it will be on the top. And yoga pants also okay. Some people see it you're doing yoga with the action that is able to tolerate. Belly bands put on here so they can secure it, and then this pants is actually a low cut pants. So the waist will be below, low cut, and this is a wrap so that you can make it secure. And you want to wear skirts, so make sure the waistband is on top, not pressing on the stomach. So this kind is high-waisted, so this kind of shorts also. Or wear the layered outfit. So people is not so easily notice. Okay, so this is like what ordinary people wear also. Okay, so more layer, and you can confine it inside. You can wear just jacket, vest, so no need special clothing. Okay? So, okay? Clothing, appearance. Right now we talk about eating and digestion. So we have a few concerns that you learned this morning about gassy food, about food that can produce odor, right? And also about constipation and diarrhea. So now we see the eating habit and also digestion. So after healing, okay, post-op, there is no special diet unless other health issue. Meaning, I come for the colostomy, right? But I also have diabetes, I have heart problem, I have hypertension. Okay, so I have to take care of my diet. Okay, I cannot take high cholesterol diet. I cannot take high sugar diet because I have my previous medical issue. Okay, so unless you have previous medical issue, otherwise just well balanced diet. And the simple guidelines about the diet. Okay, so usually, initially, immediate post-op, the doctor would advise, or the doctor would order low residue diet. Low residue diet is easily digestible. You have just done the surgery, okay, onto the gut, so you do not want cost burden of it. So low residue diet includes only foods that is easily digestible and exclude raw food. Exclude especially the fruits with the skin, because there is high fiber. Don't imitate, and also vegetable. Then eventually we'll go to regular diet. Regular diet means no restriction. Any diet you want to eat like normal. But I know that onion produce gas and also and also order later because I want to go outing. And so today I'm going to take onion. Okay? So adjust, but no need to have special diet. Try one food a day if you have not eaten since surgery. So meaning what? So after surgery, I start on soft diet, I start on low residue diet. Then I have not taken the whole grain break so far, a long this time. So if I want to take this one, this is a new food to me now. So I will take this one pack of new food a day. So that if there is problem, then I can identify that this problem is caused by this food. Okay, so that is the minimum. Try one food a day. Then eat small portion at first. That means the portions that you take for every meal, smaller portion than before. Then gradually will become more tolerable and increase to the amount that you usually take. Okay, not to burden on the digestive system. Remember that your digestive system also needs to make adjustments. Okay? If a small serving causes cramps or diarrhea, take small amount, then a few cramps or diarrhea, then eliminate the food temporarily. So you are like taking winning diet, no? They start off taking food one time a day and then taking small portion. If I have problem after taking this food, then I stop. Because I identify that it is due to this food, so I stop it for a while, try it again after a few weeks. So maybe that time you're more tolerable. You do this so that you won't limit yourself. Oh, I can only take this kind of food. No, remember the principle is you can take any food, but well balanced. Okay? And then you must drink plenty of water. So 8 to 10 glasses of water per day is the minimum. If you're doing hard work, under the sun, exercising, then you know that you lost fluid through perspiration, then you need to increase the intake of fluid. Okay? The dietary advice of ostomy. So certain food can cause gas and odor. Certain foods can help to thicken the flow. So try eating more. So if you have diarrhea stools, then you take banana. This can help to thicken the content. Then you can have the food that is listed here. So banana, boiled milk, boiled rice. So all these are the examples. Okay, potato as well. To soften flow, try eating more of this. So meaning the stool is rather a little dry instead of constipation. So you take this more. Fruit juice. Okay? And then the melon, okay, cabbage, beans. Okay. Then to reduce odor, try eating more of apples, buttermilk. And you can take charcoal tablet. Charcoal tablet is used like deodorant. Okay? And green leafy vegetables can help to reduce oil. Food that may cause wind, the cabbage family, right? And then some peas and beans as well, and of course the carbonated drink. Okay. Food that may cause blockage. So you may want to avoid this at all. Okay, sweet corn. So unless you grind it very small, dry food, okay, mushroom. Really have to grind it and mix with the porridge. Then no need to take. Okay, or any of the fruits that you eat with skin. Okay. What else? Okay, food that may increase the order, protein food, egg and fish, right? And then egg and fish, the onion, the cabbage family. Okay, any questions? Okay, so now we prepare the patient returning to work. Remember, so now we are talking about life after the ostomy surgery. So self-acceptance is important. Okay, as you counsel your patients, you tell them you have to love yourself. Okay, then people will love you. Okay, being open will help educate others. Meaning, we encourage patients to share. Say it out without feelings of sad and discomfort, and that is the stage that the patient successfully overcome. Okay, that situation. Okay, belts may be worn to support the abdomen when the patient needs lifting. So initially post-op, definitely there is no lifting. What can cause and what is the complication they can cause to the stomach when lifting? Prolapse, yes. Can cause prolapse, can cause hernia. So you do not want to do lifting initial post-op. But after that, maybe, okay, with fair amount, not to say that lift really very heavy things, do it as tolerated. Okay, but wearing belts is advisable. And a letter from the doctor may be helpful. Letter to whom? To your employer. So this is the explanation of the letter from my doctor, sort about my condition. Okay, so this can give information to the employer, and the employer also may empathize on and see to the type of job that the patient is able to perform initially. Okay, intimacy and sexuality. So we Asian people, we seldom want to talk about this, but this is a fact. Okay, if I suddenly have a colostomy and I have not married yet, and then I got so many things running in my mind. Later, my life will become, or if I have already married, that will affect my life with my spouse. So the truth is, you have to communicate openly and honestly. This is not to other people. This is to the spouse. Family members should get to let each other understand and be open to talk. If you are not comfortable, you tell you're not comfortable. Okay? You definitely will require some time. Okay, some time to establish the intimacy. A period of adjustment after the surgery is to be expected, yes. And then discuss if there is any problem. So can discuss with the doctor, can discuss with the ostomy nurse. And having a stoma is not a reason to avoid pregnancy. Meaning what? Meaning even though I have a stoma but I can pregnant. So this thing should not be wandering in my mind and become so and bothering me so much. Okay? But before I want to get pregnant, I need to consult doctor. Okay? Alright. Because it says what also here, healthy ostomies, the risk during childbirth is no greater than from other mothers. Now, all women undergone birth or childbirth will subject to certain risks. Okay? Right. So, if you are an ostomy, it doesn't mean that you have higher risk than others. Okay? The risk factors of having difficulty in delivery or pregnancy, none of it is indicated to ostomy. So that is the fact. That is what you need to let the patient know. Okay, then participating in sports. So wear the proper outfits so that you can carry out the sport. But it is not recommended to do contact sports, especially in the beginning of the post-op, because possible injury, because there may be possible injury to the stomach, or because the pouching system may slip. Contact sport is very rough, right? So you may get injured on the stomach. Okay. But however, this may be overcome with special protection. So as long as you know how to protect yourself, so this will be later part in life, but not immediately the patient also won't accept that. Okay, you can tell there are many athletes. They are actually swimmers, so they can swim. They are actually distance runner. They are actually skier and in swimmers as well. Athletes. Okay. Bathing and swimming. So you may bathe, okay, with the pouching system on in place, or you may bathe, okay, without the pouch, without the bag. So meaning that the side of the stomach, don't worry that when it gets touched with water, it is okay. The water will not go inside. Intra-abdominal pressure is always high, right? And normal exposure to air or contact with soap and water will not harm the stomach. So you have to clear the mist. You don't have to always cover. Okay, open up, expose the bag, it is okay. Air cannot go inside. Right? Intra-abdominal pressure is always high. And then water also can go in. So can go shower and go into the bathtub as well. May protect the barrier by tapping the edge of the waterproof tape. So what does it mean? This is the two-piece system. So I have the flange or the wafer in hand. The wafer, you do not want it to get wet, so you can put a waterproof tape on to the wafer. Because after bathing, you still want to use the same wafer. Okay? And it is very common practice also that the patient, some patients, they don't bathe with just blood, especially those but new one, and on the day of the tear off, then okay, choose a swimsuit that has a lining to protect, to provide a smoother profile. So you may, if you feel awkward because something bulging here, so you find a swimsuit that has got lining inside, so it becomes, it looks thicker than the ordinary type. Okay? For women, can wear the stretch panties designed for swimsuits. So stretch panties means that it is stretched over. Okay, remember, do not want to have direct bend or pressure onto the stomach. Then the output cannot come out. So you have the stretch panties. And men may prefer to wear a tank top and trunks. So the two things. Right? So bowel movement at the regular intervals, they clean, and then they put on the stomach cover. Okay, the stomach cover that I showed earlier, or you put on a new bag. This is for sanitary reason. For sanitary reason, because you usually swim in the public pool. Alright? Even in the pool, in your own condominium, that is also considered public pool. Travel. Patient can do sports, patient can return to work, patient have no problem with activities of daily living, eating, working, right? Now we come to talk about travel. Travel. COVID ends and then can go travel. Now even though not ends, the borders open, so can go travel. So what do you advise to the ostomy? Take a long enough supplies plus extra. So if I want to go for 9 days, I take 9 days supplies and then plus extra. If you do it double, if not, and then 1.5. Okay? Take extra supply with you because you are familiar with what you have. You're going to travel abroad. You're going to travel to other places. Leave home fully prepared. I know my destination. I want to go where, and then so I need to fully prepare. If I require some medication in case I diarrhea, in case I constipate or what, I get all this medication with me first. Seat belt will not harm the stomach. Adjust it to make you comfortable. Seat belt means this person travel by car. Travel by car, you have to put on seat belt. Okay, travel by plane also got seat belt. So seat belt is okay. Put it on. Don't say I don't put on because I have a stomach. Seat belt saves life, right? When traveling by car, keep supplies in the coolest part. So keep in the coolest part. Keep in the place where you sit. Okay, don't keep behind. Okay, near to the windows, the windscreen there, because it's hot. Don't keep in the boot also. When traveling by plane, place the supplies in a hand carry luggage. Because sometimes the check-in luggage can go other place. Then you lost your supply. So you take it, you can carry luggage, go with you, okay, on board, go with you into the plane, right? But scissors, you can put in the checked luggage. Scissors, this is to prevent security problem. People check and then ask and you have to tell so much. Okay? So scissors, you need scissors for cutting. Scissors put in the checked luggage. Declare first and check in. The rest I put in my hand luggage. To prevent that I reach the place already, my luggage go somewhere else. Alright. Have a note from your doctor stating that you need, okay, to carry the ostomy supplies. So this can reduce the troubles of having to explain to people or the customer. Okay, and have this information translated into the language of your visiting country as well. So maybe you're going to Germany. So first of all, the instructions must be in English because English is international language. Then next, you may want to translate it into the language what the German say, what the German converse. Okay, this is to prevent in case, okay, that you have to talk to some other people from country that do not understand English or do not understand your Okay, prevent travelers diarrhea. Okay, travelers diarrhea is very common for people with ostomy or without ostomy. Then we go to a new place. Sometimes it's the emotional, and sometimes it's any other issue or contaminated food and water. Because you're eating out. So regardless you are ostomy or you are non-ostomy, prevent travelers diarrhea by drinking only from the bottled water. Third, or drink boiled water only. Do not take ice. Okay, ice will be contaminated, and avoid the whole fruits. Whole fruits, that means fruits with the skin, pepper with the skin, contain a lot of fiber that can cause diarrhea. So do not take raw vegetables as well. Could be not properly cleaned. So these are the tips. Okay? Any questions? So all the information that you learned just now is actually for you to convey to an ostomate and telling them actually there are so many kinds of activities you can do. No restriction, but first you have to accept yourself. Okay, so self-acceptance is important, and then the rest is slowly adjustment. Okay, all right. Important sources of information and the support group. So this is very useful. Okay, now the support group usually is formed by voluntary organization dedicated to help those who have ostomy. And the people, this volunteer person that form this organization, usually they themselves is an ostomy. Okay? And what do? They provide one-to-one support. They provide local support group meetings, upgrades, conference, and also giving education material. They help to teach others. I am an ostomy, but I can be a caregiver as well. Okay? Because I learned so much about how to manage. So can have a full productive life after ostomy surgery. This is what that is always emphasized. And also make to share your feelings and ask questions. So ostomies can share feelings. Ostomate can share experience of successful adjustment to the new situations. So this will lift up the emotion of the new ostomy. Okay, so this is the function of the support group. And we have this Stoma Care Society of Malaysia, which is in KL. So that is the headquarters. And then in Penang, Stoma Care Society of Malaysia, Penang branch. Formerly, the name is Persatuan Stoma Care Malaysia, PSCM. So now the name has changed to Persatuan Ostomy Pulau Pinang, POPP. The organization has started or formed in 1987, and it is by a voluntary or by a group of volunteers. So they are doctors, nurses, especially hygienists, and then ostomates, the patient itself, and interested lay people. Some people they donate, or many of the medical supply companies, they become part of the organization as well. And another important thing is the ostomates family member. Okay, some of them also join into the organization. So they are solely run, okay, without charging money, give free counseling. And they also set up a stoma care clinic in the complex Masyarakat Penyandang. So the Caring Society at Jalan Utama, and this is the Google Map. It has been closed for some time due to COVID, and they are the complex Masyarakat Penyandang was so busy engaging with the COVID issue. Until recently, the stomach care clinic restarted. Many of the nurses, they are retired nurses, matron sisters from GH. And this clinic open every Wednesday except public holiday. If public holiday fall on Wednesday, and the time is 2 p.m. to 4 p.m. Okay, so it's a good information to introduce to the new ostomy. And this is the pictures, the building. So the aim of the society. Now I'm talking very particularly to about the Stomach Care Society of Malaysia, Penang branch. So the aims of the society is to provide moral and social support to ostomates and family members. So moral support and to provide and to strive continuously for quality stoma nursing care. So gain knowledge and that help other people. Training in this specialized area of nursing care as well. So they give training to nurses as well for ostomy care and so who are willing to volunteer and sacrifice the time for the ostomies. Aims number 4 is to provide the ostomies with the correct appliances. So because they give counseling, they take turns and sit in the clinic. If ostomy has any problem, they can come to them and then they can recommend if there is incorrect use of appliances, then we can recommend the correct one. Okay, and the ostomies have to pay $50 a year. Okay, $50 a year, but for those that who are really poor, then they don't have to pay at all. So this to help them to get the appliances at a reduced price. Remember, cleaning, changing, this is everyday day in, day out issue. Okay, so if they register membership fees, it's not to say pay them, no. So it's a membership fees to be the member of this society, they pay $50. To provide financial assistance to the poorer ostomies as well. Okay? So remember, as we teach the patients, so it is important to talk about, okay, what have you learned in theory and in practical, the skills. Also, recommend to them the support group. These are the people who constantly do the emotional care and psychological care. And the references. Okay? All right. So before we end, we do a quick summary on what we have learned today. Any questions first before I proceed? Any questions? No, we will do a quick review and then we end the session. Module 1, Module 2, Module 3, book. So in Module 1, the main topic is about facts about the ostomy and ostomy care. So still remember, what can you remember from your learning in Module 1? be sensitive. One more time. Thank you. So in module 1, you learn about what? Context that you can from the book. First of all, you talk about the A and B, isn't it? A and B, huh? So we focus on the intestine. So let me ask you, the small intestine contains of 3 parts. So small intestine, 3 parts. Huh? The last part of the intestine is ileum. Ileum. So the first part is duodenum, second part is jejunum. Yes, and then ileum. Ileum. So ileum is part of the intestine that can be brought up to make in the ostomy surgery. Okay, so the opening that created on the ileum, you call it ileostomy. Alright, so in ileostomy, how can you describe about the output or the discharge from the stomach? Yes, it is very watery. It is very watery, and then it contains high acidic enzyme. Yeah, this is immediately comes from the small intestine, and this is actually the last part of the small intestine. Good. So, anatomy now you refer in that, okay, when you talk about the external condition, the GIP. So we also talk about some new terms. Have you heard about ostomy before? Before this session, have you heard about this word ostomy? No. No. Okay. So ostomy is what? Yeah. So that means the patient, okay, the patient who has undergone a colostomy, ileostomy, so all the ostomy surgery. The indication of ostomy, it can be the baby born with abnormal condition, so require ostomy. It can be what else? The indication? It can be trauma, right? It can be due to disease. It can be due to cancer, like blockage. So the ostomy, or especially we talk about colostomy, it can be temporary and can be permanent. So temporary colostomy, what is the purpose? Why have to do an opening there? Yes. So to rest the disease part, to allow healing to happen. Right? And then when we talk about colostomy, you know that the discharge of the output is getting more watery or getting more thicker when it comes to the left side. Thicker. Yes. Because there are more parts of colon left over and absorption of water happen. Talk about the ostomy appliances. So you have visited the tables there just now. What is the what can you remember, okay, about the type of the mouse? Maybe I take up one and ask you. So this is 1 piece or 2 piece?
1 piece.
1 piece, because the flange of the wafer is attached to the back. 1 piece. So next, how can you describe? Drainable, yeah, because there's an opening here. And then what else? Transparent. So you can easily check on the color of the stoma and also the content, color and also consistency, and also any other content. Okay. And as for filter, not this one, no filter. If there is a filter, it usually is a carbon filter, that means charcoal. So what is the function of the charcoal? Reduce odor. So where can you buy these ostomy appliances? Pharmacy. Besides pharmacies, you can get from medical supply distributor, and also you can buy where? Cheaper. Right from the internet. And when the patient has got its supply, then how to keep it so that it maintains its shelf life and it is okay to use. Cool, dry place. Okay, gather all together, all the things together. So you want to reach it, then you can have easy access. Okay, so module 1, we also talk about some common problems. And the most common problem for ostomates is peristomal skin problem. So peristomal skin problem, what is the major reason that caused the problem of the skin? Poor fitting bag. Is it? What did you say? Leakage, yes. Leakage, yeah. So leakage can be due to poor fitting bag. So it leaks out. Right? Or poor fitting out, poor adhesion. So if poor adhesive, so cannot seal, cannot stick on the skin properly. So take care of this. You do not want the content to touch on the skin. Content is supposed to be inside. So next we go to the module 2. So module 2 you are doing great. So you have watch the video, do it together with me, cutting the colostomy bag and practicing on the component skills for fitting the two-piece system as well. Okay? Do you have any questions to ask about that? So module 1, you learn all the facts. Module 2, you learn the skills. Module 3, how to help the patient. Okay, the ostomates are living a productive or meaningful life. So with your knowledge about how to adjust to the new way of living, then you can help the patients to feel better. Okay? When patient has knowledge, then they can adjust better to the changes. Remember, having a stoma or undergone an ostomy surgery, this is regarded as a major changes. Okay. Any questions? Thank you for your attention. Thank you for your participation.
Thank you.